Hi, this is John Kanelopoulos from our office here in Athens, Greece. I know this may not be a significant medical innovation, but I thought I'd share this with you today, and this way we can protect ourselves from all the aerosolized droplets from sneezing, coughing, and even breathing of patients who are infectious. Obviously, we're concerned of the common cold, flu, and currently the coronavirus transmission. I know many slit lamps may have a protective shield for the examiner from the examinee and vice versa. There are several commercially available, and based on those ideas, I devised a 2-minute protective shield out of a simple cellophane letter size sheet. I'll share with you the details, how to make it, how to install it in your slit lamps or your surgical microscopes, and how to enhance your protection from transmission of any aerosolized disease of pathogen. I hope you find this presentation interesting, and I hope we can increase the safety for not only our medical staff and colleagues, but also our patients as well. Thanks so much. All right, so I'll show you how easy this is. These are the actual dimensions, and I'll include these in the video as a readout. This is taken from a commercially available acrylic or plexiglass product available out there, and obviously this opening here will fit your slit lamp or microscope oculars, and this is in millimeters and in inches. And from this we've made the actual template with a cardboard. It's very easy to do, with a very sophisticated instruments of a ruler and a pair of scissors. So we're using some clear cellophane covers, as I mentioned before, and all we need to do is produce our slit lamp protective cover from a clear cellophane cover that we can find commercially available on any copy shop. So we're taking our template. We actually decided to go about an inch lower than the actual template and create a larger margin superiorly to protect more the clinician's eyes. So we're gonna place this, not tilt at the edge of this. This is the size here is a letter size, cellophane of letter size. We're gonna go 1 inch under, and we're just going to mark the opening. It's kind of fun to do. So this is all we need to do. And now by taking the opening that you need to do, all you need to do is round up the corners to avoid any accident, somebody hitting their eyes on it. So we're rounding up the corners. And then we're just gonna enter this area here to create our predetermined opening. So we're gonna go in with our scissors. Actually, if you have kids at home, this would be a great exercise to do at home. And we're gonna go around to cut this the best possible with our scissors and to create our final product. And I showed to you before how we can actually place this in almost every slit lamp. This is a universal cover. Again, these are the dimensions, and I'll add these as a JPEG in the presentation. Thanks so much. Okay, so here's our ready product. The shield prepared as we saw before. I'm narrowing the pupillary distance on this slit lamp, and we're gonna see how easy it is to place over. Let it fit right between the oculars and the slit lamp. And then my pupillary distance is maximum 75. And see how well it sits in place and how it shields the examiner from the examinee, how easy it is. And I'm going to show you here by sitting in the slit lamp to bring my hands through it while viewing through the optics of my slit lamp and make all the adjustments or even measure the intraocular pressure. Exact same scenario here with our Hextrite slit lamp. You can see how well and how flexible it is in changing the pupillary distance, and how it shields all the functions that the clinician may do, even tonometry, adjusting the Goldman applanator. This is, as I mentioned, Hextrite slit lamp. Same thing here with a Visualaz laser. Again, you can see how easily this can come out. Pretty much fit in any microscope, more or less slit lamp. Come in, position in place, and then adjust the pupillary distance. We have several of these. These are the CSO slit lamps, beautiful pictures, and same trick here, adjusting the pupillary distance and using this very easy self-made shield from a cellophane, letter size, a pair of scissors, and the parameters I mentioned to you. Again, I'm going to narrow the pupillary distance, place our shield in place, and then adjust it accordingly. Again, intraocular pressure measurement. I'm going to switch hands here on my iPhone. I apologize. All the measurements, all the settings can be done very easily with the hand moving around the shield. All right, so this is what we were trying to make here. The little stickers, blue stickers here on the side are just to protect us from not bumping into it. And this, as I promised, are the specs in both metric and imperial system, millimeters and inches. And again, this is a little bit smaller than a letter size, and these are the final images of it being placed on the slit lamp. So a very easy way, you can do it within a few minutes, how to protect you and your patients. This is John Canelopoulos signing out. Thanks so much for watching this.